The golden age of retirement used to be 65 years old, but now people are working longer. If you're 65 plus and still working, navigating the ins and outs of Medicare can be really complicated. But don't worry, I'm here to help you through. Hi, I'm Christina, a registered nurse with a background in care management, and I'd love to help you with your Medicare questions. Today, I'll explain how to enroll in Medicare if you're over 65 and still working. So let's get started. The ideal time to enroll in Medicare is when you turn 65 years old. This is your first opportunity to sign up unless you qualify for earlier enrollment related to health conditions. This initial opportunity to sign up is called your initial enrollment period. This period is a 7-month window surrounding your 65th birthday. You can have Medicare coverage and also continue to work. You don't have to be retired. Some employer-sponsored health insurance plans allow you to continue using their plan for coverage, while other employer-sponsored plans will require you to use Medicare insurance as your primary coverage. The best way to find out how your plan will work is to talk to your employer to see how they handle Medicare and employer-sponsored plans. If you're still working when you turn 65 and want to begin Medicare coverage, you'll need to sign up yourself through Social Security. It won't start automatically unless you're already receiving your Social Security benefits. If you need to sign up, you can do so on the Social Security website or by calling 1-800-772-1213 or contact your local Social Security office. If you already receive Social Security benefits before turning 65 and were automatically enrolled in Medicare A and B, you can choose to unenroll from Part B by contacting the Social Security office. Now let's talk about some other enrollment options. If you choose not to enroll in Medicare during your initial enrollment period, you'll want to make sure that you follow the timeline to qualify for a special enrollment period, commonly called SEP. This will allow you to delay Medicare enrollment without incurring late enrollment penalties, which we'll discuss in a minute. It will also enable you to enroll seamlessly when you're ready to transition coverage to Medicare. If you don't enroll during the SEP timeline, you risk having to wait to enroll and potentially having a lapse in health insurance coverage. Continuing to work past the age of 65 while maintaining creditable health insurance coverage is one of the most common qualifiers for a special enrollment period. You can also qualify for an SEP if you are the spouse of someone covered by creditable employer coverage. The key is making sure that the coverage is creditable. Things like COBRA, which is insurance for eligible employees who have lost or left a job, and retiree health coverage don't count as current employer coverage. Other circumstances may not qualify for an SEP, such as if your employer has fewer than 20 employees or your coverage is through your partner's employer health insurance, but you're not married. When you retire or your employer coverage ends, you'll have a certain time period to sign up. You'll have 8 months to enroll in Medicare Part A and B, 2 months to enroll in Medicare Part C, and exactly 63 days to enroll in Part D using your special enrollment period, which again will help you avoid a late enrollment penalty. You'll want to apply for Medicare Part A and B before your employment ends so that Medicare coverage can begin the first day of the month after your employer coverage ends. During your Medicare application, you'll need a statement from your employer attesting that you had creditable coverage during employment. In the description section below the video, you'll find the link to apply online for Medicare Part B during a special enrollment period. If you miss your initial enrollment period and you don't have a special enrollment period, then you'll most likely face some late enrollment penalties. So let's take a look at what those could entail. Late enrollment penalties are calculated for the duration of time that you could have signed up for Medicare but you didn't. Each part of Medicare calculates the penalties a little bit differently. Part A, the hospital insurance, That late enrollment penalty only applies if you do not qualify for premium-free Part A. Most people don't pay a premium for Part A because they or a spouse have worked for 10 years. If you do have to pay a premium for Part A, then the late enrollment penalty is an additional 10%. This is charged for twice the number of years that you delayed enrollment. Let's take an example. If you waited 2 years to enroll in Premium Part A, you would pay the monthly premium plus 10% for 4 years. Part B, the medical insurance late enrollment penalty, is an additional 10% added to the monthly premium for every full year you were eligible for Part B but did not enroll. This penalty is permanent, so you'll have to pay it for as long as you have Part B coverage. For example, if you delayed enrollment for 2 years, then you would be charged a 20% late enrollment penalty plus the standard Part B monthly premium. In 2023, that would be an extra $32.98 monthly for a total of $197.90 instead of $164.20. Part D, the prescription insurance late enrollment penalty, is an additional 1% added to the premium for every month that you delayed enrollment and didn't have creditable drug coverage. This penalty is also permanent, so it will continue as long as you have Part D coverage. If you've been charged with late enrollment penalties and feel that this was done unfairly, you can appeal the decision. The link to the appeal request form is in the description below the video. Please note that you'll have to continue paying your premium plus the penalty in order for your coverage to remain active while awaiting the decision. Deciding on whether or not to delay Medicare enrollment is a personal decision. Generally, most people go ahead and enroll in Part A since the majority of people do not have to pay a premium for Part A. The decision to delay Part B insurance can be a little more complicated, but considering some of these questions could help you decide. Does your company have more than 20 employees? Individuals employed by small companies with fewer than 20 employees have to sign up for Part B, which provides better coverage, your employer-sponsored plan or Medicare. Which plan costs more, your employer-sponsored plan or Medicare? Do you want access to your Medicare benefits while also keeping your employer-sponsored plan as primary coverage? How will my family receive insurance coverage? All of these factors are important in deciding when to enroll in Medicare, which Medicare parts to elect, and how to delay enrollment without incurring late enrollment penalties. I hope these tips have been helpful. Feel free to head over to healthnews.com to read Medicare articles. You can also comment below with questions and we'll be sure to get back to you. And don't forget to subscribe to our Health News YouTube channel. Thank you, and I'll see you next time.